Good morning, everyone. This is PA in the AM coming to you to discuss dizziness. So I've been a PA for the last 9 years and I've been working in head and neck surgery. And my topic today is to discuss dizziness, how I see it in a clinical setting. So my type of dizziness that we're seeing could be caused due to issues in the inner ear. Initially, when you come in for a history, the main questions I'm going to ask is the duration. So how long is the dizziness lasting, whether it's seconds, minutes, or hours? And that's key in order for me to determine what could be the cause of your dizziness. And then another thing is associated symptoms. So is your dizziness, which is true spinning sensation, like you're on a merry-go-round, or is it associated with nausea or vomiting? Is it associated with ringing in the ears, hearing loss? So one of the common causes of dizziness is called benign paroxysmal positional vertigo. And this is a very common cause of dizziness. And it's usually a positional vertigo because there's specific changes in position in your head. And it may occur when you tilt your head up, when you're tilting it down, when you're lying over, rolling over in bed, or sitting up sitting up when you're laying down. Symptoms usually last less than a minute, and the cause of this is due to the inner part of the ear. So the inner part of our ear has semicircular canals, and the semicircular canals are our balance organ of our ear. And there are little crystals called otoliths inside of the ear that could become dislodged. And I've seen this in people that have a car accident and all of a sudden they start having this positional vertigo, or someone once did about 10 cartwheels in a row and that caused the dizziness as well. And the underlying way to diagnose this along with the history is in the physical exam. There's a maneuver called the Dix-Hallpike maneuver. When I lay the patient back and I tilt their head off to one side and I look at their eye movements. And you can see a nystagmus, which is this rotational nystagmus in one direction. And so if it's happening on the right side or on the left side, there is a treatment called an Epley maneuver that I could do in the office. And that is similar to the Dix-Hallpike, but we're doing a rotational motion with their head in different positions for 30 to 60 second intervals, and that can move the crystals back to where they're supposed to be. And so that can sometimes be a really quick fix. Other times patients have to refer to physical therapy. Another really common cause of dizziness is actually migraine. And I know this is not related to the ears typically, but when they have a normal physical exam and the Dix-Hallpike maneuver and all the neurological testing is normal, then it could be a vestibular migraine. So symptoms of a vestibular migraine, typically a patient presents and they have dizziness as well as headache. They could have sensitivity to bright lights or loud noises, nausea, vomiting. And with a migraine, a lot of times just using like a NSAID like ibuprofen or Tylenol can help initially with the pain. But if patients are having them more frequently, like weekly or daily, then I would refer them to see the neurologist and do additional testing, and they could have additional types of treatment where they're able to prevent headaches or migraines. So another cause of dizziness is something called labyrinthitis. And the labyrinth is the inside of the inner ear, and that could become inflamed due to an inner ear infection, and it can cause issues with the person's balance and their hearing. It can occur with a cold, through a flu or middle ear infection that spreads to the inner ear. The symptoms include severe vertigo, nausea and vomiting, tinnitus or ringing in the ears, nystagmus, which is your eyes moving, and a hearing loss. And the treatment for labyrinthitis is to alleviate the symptoms. So a lot of these patients are really, really sick. So they come in and they're super dizzy for hours and hours, sometimes even days and weeks. And so giving antihistamine like meclizine can help with anti-nausea, and sedatives can help them just kind of be able to walk and function. Corticosteroids can help with any inflammation, and sometimes it could take patients several months to fall back to normal, and they may need some rehabilitation and physical therapy. Another cause of dizziness is something called Menieres disease. And Menieres disease is fluid collection in the inner ear. And there's pressure that can build up of the fluid and damage some of the delicate structures in the inner ear and could cause a variety of symptoms. But there are 3 symptoms that need to occur in order to be diagnosed with Menieres. So the first thing is feeling of pressure or fullness in the ear, also a hearing loss, and ringing in the ear associated with severe vertigo, which is the spinning dizziness, like the merry-go-round feeling. The workup is usually initially a hearing test, and then a CT scan or an MRI to rule out any abnormality in the ear nerve or in the brain. And then the treatment also anti-vertigo medications like meclizine, anti-nausea medicines, a low-salt diet, and or a diuretic can help also with Menieres. So that pretty much sums up dizziness. So if I cannot figure out the cause and their exam is normal, I would likely refer them to see the neurologist, the brain specialist, and they may recommend further imaging like an MRI or CT scan to do a full workup. Since it's Favorites Friday, I'm going to discuss a couple of my favorite things. This first thing is a new foundation I just bought from Rodan and Fields. And this, when you put it on, it makes your skin really soft. I never had a foundation that was liquid, that didn't make me feel like my pores were going to be clogged and I was going to break out. So I've been using it for the past week or two, and it's really great coverage and it works really great. My next favorite thing is a book called Start With Your People by Brian Dixon, and the author reveals the key success in business and in life, relationships. With illuminating stories and simple strategies, this one-step guide will help you maximize your most essential resource and unlock the door to purpose, passion, and profit. So if you want to get a hold of this book, you can click on the link below through Amazon, and if you have Amazon Prime, you can get free shipping. So thanks everyone for listening about my talk today on dizziness. Tune in next week for a talk on hoarseness. If you have any questions, feel free to drop them below. This is PA in the AM signing off. Take care.